note of that, you know. I'm making the notes to myself. Next thing I'm going to do, since I'm at the neck, is I'm going to do the assessment of the neck, and the first thing I'm going to do is to palpate the carotids one at a time. Lower third of the neck, right? One side, then the other. You won't feel anything if you don't want to know, okay? After that, I'm going to auscultate. I believe it says with the diaphragm and then with the bell, okay? So I'm just demonstrating this is how I'm going to do it. Okay, so I'm done with the neck. Pulses and feeling for thrill and listening for bruit. Okay, now I'm going to move down to the chest. So I will cover the perineal area, and I will bare the chest. All right? Okay, so again, first thing I do is look, see what the skin condition is, see if there's any heaves or what have you, and I see that there is an IV sticking out at the upper level of the chest, right? Okay, you're going to inspect the AP ratio, okay? Fine. All right, now, I'm going to look at the heart. Everybody making check marks, am I hitting what I'm supposed to hit, and so on and so forth. All right, so the sternum is down the middle, yes? Mm-hmm. All right, and I'm going to aortic, pulmonic, tricuspid. So their left, or my left is their right, right? Okay, so this is going to be their left because it's my right, and then I know the first valve is the second intercostal space on the right side of the sternum, okay? So, first intercostal space, second intercostal space next to the sternum, aortic. Pulmonic is right across on the left, pulmonic. Then the tricuspid is around the fourth, tricuspid. And then the mitral is the fifth intercostal space, mid-clavicular line. Okay? It says again that you have to listen, I believe, first with your diaphragm and then also with your bell. I'll settle for the diaphragm, okay? All right. Then, what else does I have to do? I have to be able to tell you, as the where's my instructor?
Right here.
Okay.
Okay.
The apex of the heart is here. The base of the heart is here. My S1 will be heard best at the base of the heart. My S2 will be heard best at the mitral valve or the apex of the heart. The apical impulse will be here, and this is where I'll listen for an apical pulse. Okay? Then,
I'll send it to you guys if I can.
the mannequin will have a heartbeat. It will not be anatomically correct, so you have to fish around to find the microphone. Okay, and once you find the microphone, I want you to listen and count the rate. How fast is it going? And listen for the rhythm.
How long?
How long it takes you?
30 seconds?
I don't care, 15 seconds if you can do 15 seconds, but if it's irregular,
Yeah.
right, you're going to
1
have to
minute
count
then.
longer, all right, to get the rate.
Is
So
that a
you're gonna-
dance
You're going to be the
thing?
rate, yeah. This is, you're going to
All right.
identify the rate in the rhythm, okay? Because you have to tell me, is it regular or irregular? I'm hearing this mannequin at about 80 and it's regular or it's irregular. Remember, rhythm has to do with how frequently and are they evenly spaced, the beats. 1 lub-dub, 2 lub-dubs, 3 lub-dubs. So, you know, if you're hearing lub-dub, 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 that is a regular rate in rhythm. If you're hearing lub-dub, 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 it's irregular. Okay, it's irregular. Online, don't you have some of that online? Okay. I am not expecting you to tell me if it's a murmur or, you know, I don't want that. I just want, is it regular or irregular? That's it. The rate, and is it regular or irregular? Okay, so as long as I'm here, I am going to, since I'm here and I'm moving this away, I'm going to listen to the lung sounds, okay? And the book says 5, right? And how do I listen to lung sounds? 1 inhalation, 1 exhalation, 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 1 inhalation, 1 exhalation. 5. 5 on each side in a Z pattern, okay? Then after you have demonstrated you know how to do this, I'm going to ask you again to find the microphone, because the heart sound, or the lung sounds and the heart sounds on these mannequins are non-anatomically correct. So I'm not going to hear lung sounds over the lung fields on this. I have to find the microphone. Fish around for the microphone. After you've demonstrated I know how to do this and where to go, okay? Find the microphone where you can hear the lung sounds the best, and listen to them and tell me, are they clear or not? You do not have to say, is a rail, a bronchi, a friction rub. I don't care. Is it clear or not? Period. Got it? Okay. So then I'm going to move down to the abdomen. I'm going to, because he's on his back or she's on her back, I'm going to move to the abdomen. First thing I will do is look. I don't expect a wound in the abdomen of what it could be. I look first. Skin, you know, what do I see? If this is here, I'm going to make a note to myself. Open surgical wound, because if the edges are straight, so it must be surgical. Below the umbilicus, above the symphysis pubis, okay, on the abdomen. Looking at the wound bed, it is just pink, and it looks like it's got some exudate in there. And then I would measure it and write all that down. Length, width, depth, what the wound bed looks like in the peri-wound area. Okay, so that's my looking. All right, then I'm going to do auscultation. We're starting in the right lower quadrant. My left is her right. Okay, so remember, the abdomen is split into 4 quadrants through the belly button. So here and here. All right, so my her right lower quadrant is here, right? Okay, so right lower quadrant, right upper quadrant, left upper quadrant, right left lower quadrant. Okay, if I have a mannequin that I can get vowel sounds, I will, but don't count on it. All right. Then the next thing they want us to do is light palpation, and it's in the same order. Here, 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 and here. That's it. That's it. Okay, so I'm done with the abdomen. I see the wound, I've measured it, okay? So now what I want to do is I'm going to do peripheral vascular, all right, before I move down, all right? So I already did the carotids. I'm going to do the brachial, radial, femoral, popliteal, behind, ooh, I'm sorry, Jerry, didn't mean to amputate. Popliteal, okay. The
Behind the
posterior tibialis and the dorsalis pedis, okay. And I will do that on each side. Dorsalis pedis, posterior tibialis, femoral, okay, the radial, and the brachial. This peripheral vascular system, so while I'm at it, I'm going to do the profile sign, okay? I think that's on page 1, right? Profile sign, it's a little hard to turn this, so I'll show my instructor. Here's how I would do the profile sign, and I would look for an angle of 160. Okay? And then I will do capillary refill here, 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 and here. Okay? And it should be less than 3 seconds. I will examine the skin of the legs to make sure there's no loose. when I'm done with that, I will turn the patient over. I will help. When you do this, I'll hold the patient over, okay? And again, you're going to show where you will listen to lung sounds, okay? So I want at least 6. I think it shows 9, but I'll deal with 6, okay? So 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6. Huh? Okay? Then I want, if you haven't done it on the front, you can do it on the front or the back. I don't care. This is how I would check chest expansion. Take a deep breath, dear. Then I'll examine all the way down, and there's another boo-boo.
On the coccyx, right?
Right? Sacral area. And again, I look at it, measure it, write notes about it. And I'm done. And I'm done. Okay, now, teacher, did I hit all of them?
Yes,
Do
you
I have
did.
any no's?
Nope, you
Amputation.
did great.
I did, yeah. except
Automatic fail.
amputated. Huh?
Nothing.
Amputated the limb, right?